Okay, great. Trish, you can go to the next slide. A little background on Trish. Trish is our Senior Vice President of Clinical Operations for Promises, and she came to us with over 27 years of experience. She's a licensed clinician and certified expert in co-occurring disorders and substance use. Trish is dedicated to delivering clinical and operational excellence through evidence-based trauma-informed care. She has been an adjunct professor for 16 years, currently teaching in Drexel University's Master's in Family Therapy program, trained in DBT. She specializes in multifamily DBT for groups for teens with ADHD, trauma offenders treatment program, and substance use disorders. She developed the first young offenders treatment program in Delaware and is a sought after speaker in adolescent behaviors, ADHD, trauma, and family systems. She also maintains a private practice focusing on adolescents and young adults. So, like I said, if anyone's going to be talking to us and teaching about ADHD and substance use in young adults, I think this is going to be a great training. Our CE process, uh, same as last year, if you've taken a course before with us, if you are here, if you are looking at this screen, you are signed in. Um, if you miss more than 10 minutes of the training, then your email is not collected. So being here is your sign-in sheet. But that also, with that said, you can't be sharing a device with another person. So if you and a colleague are looking at the same computer, only one of you is getting the sign-in credit. So just make sure that you're not sharing a computer or a phone with anyone. If you do switch from a computer to a phone back to a computer, that's totally fine. When you log in or you come into the room for this Zoom, that means that you've signed in. And then after the training, you'll receive an email from JotForm with a survey. You must fill out that survey within the week. So by next Friday, you have to fill out that survey. I recommend just doing it today. I try to get it out within an hour or two of the webinar. So if you don't receive it by the end of the day today, reach out to me and I usually send those out like within an hour or two. And then if you don't meet the requirements, you'll also receive an email that says you did not meet those requirements. So either way, by the end of the day, you should receive an email from JotForm or from Promises with that information. And then after you fill out your survey, you'll automatically get kicked back your completion with the survey. So, or your with your certificate. And you'll get 2 CE credit hours from recognition with NADAC and NBCC. And like I said, the other slides and resources are sent in a separate email next week. Okay, next slide. During the webinar, again, it's the same as last year. If you have any comments, feedback, questions about technology, the CEs, the webinar functions, put those in the chat. That's something that I will be monitoring and making sure you all are in the right place. The Q&A, I'd like to save that space for questions for Trish. So if you have anything about the actual content, resources that she's sharing, and just put those there, and then I send those directly to Trish so she doesn't have to like sift through them as we go. And so we'll have some space to answer questions during and at the end of the webinar. And that's it. Oh, for next month. So next month we have Jamise is back. And so if you saw Jamise's webinar last year on treatment planning, this is a very like a great follow-up to that training. So this is be shaping quality behavioral health experiences. And I will send the registration link here in just a few minutes so you can sign up for that one today, and that will be February 28th. Next slide. Oh, Trish, I'm going to pass this over to you. Again, thanks. If anyone needs anything, I'm in the chat. And if you have questions for Trish, put those in the Q&A. I'll let you take it away.
Thank you. Thank you. All right, everybody. I am excited about today's topics. For those of you that know me, you know that this is a topic near and dear. But before we get into it, it is important for us to just highlight again who we are. So who is Promises? So we are a growing organization that continues to service those that are in the mental health and substance use space. We have currently 4 sites in Texas. Our newest one opened up in DFW. that we service again mental health and substance use. So each of our sites does something a little bit different, where we are able to provide access to care from a detox level of care all the way through full continuum. We have one in the state of Pennsylvania, which is where I am coming to you from live. We have one in the state of Massachusetts, one in the state of Georgia, one in the state of Florida, and then one in Tennessee, which is where our home office is also located. So I say this at every time that I do a training. I highly encourage, because I am a trauma informed practitioner, I always encourage anytime that you are referring somebody to a treatment, hopefully it is ours, but if it is anywhere else, I highly recommend that you take the time to pull up the website, look at the pictures with your client or your patient, and walk through with them that this is where they will be. I always equate it to when you think about taking a child to college, we all want to go to the college. We want to see where they're going to rest their heads. We want to see where they're going to be spending the most of their day, because it allows for us to breathe easier as both the college student or the future college student, but also as a parent. That is no different when you're sending somebody for access to care. So I highly, as a trauma-informed practice, encourage you, check out our websites. These are our pictures from all of our different locations. Make sure that they understand where they're going to lay their head to rest at night, where their facility is going to be, because it allows for somebody to ease some of that anxiety associated with those first initial steps. So check us out on those. All right, so we're going to get started again with the topic of ADHD and substance use. And while I'm going to focus a lot on the young adult, because we're going to talk about the brain, I'm also going to extend this to adults. And so the objectives for anybody that's ever done a training with me, objectives are everything that I go over during the training. So I do not need to go over the objectives because I'm going to quite literally go over them in the training. I do want to give, so I've had a couple of people that have asked, so why is this training so important? So again, personal experiences. So I love ADHD. I say this all the time, right? I have been working with ADHD for years and years and years and years. I must love it so much that I then married somebody who had ADHD that I didn't know. He hadn't been formally diagnosed. I had a child that I was like, man, I feel like I'm paying attention to things. Maybe it's because I'm in the field. She feels like she's got ADHD, right? I started saying those things when she was an infant, that I was like, man, but I really thought that this was me being like looking for something, right? I'm in this field. Then I have a formal diagnosis for her. Some of my very best friends also have ADHD, ironically enough, right? So my closest. So when I say I love ADHD, I quite literally mean I love ADHD, right? It has a unique presence in our space, but it is, and that's what we're going to talk about, one of the most misunderstood. That's where this came in. So I had a daughter that had ADHD, pretty rip-roaring ADHD, right? We'll talk about it. She has given me permission to talk about it. I got involved in a community group that was a national community where volunteers participated. It was called Narcotics Overdose Prevention and Education, NOPE. And their whole presence was in light of this opioid epidemic where we were seeing tremendous amount of overdoses. They created a program that would go into the local communities and high schools and middle schools, and they would have a forum during the day where they educated students, right? This whole like say something, right? Like if you know somebody that's using a substance, particularly opiates right now, right? The prescription medications that were really booming at that time, right? Say something. And then in the evenings, they had families, right? So I always participated in the evenings to educate the families, to speak about the importance of staying connected and understanding what was going on. They always had a speaker who lost a loved one to an overdose. And so that was part of this whole program that I had participated in. And so I would always do my part, but obviously I would start communicating and having conversations with these family members who lost their loved ones. Now I'm also actively working in this field, working with young adults and adolescents primarily, and then continued to work with adults as I progressed in my career. But what I noticed, and I'm not exaggerating when I say this, every person that spoke, their loved one had ADHD. And so that got me thinking, right? So here I have this daughter who is young that I kept saying, man, I like know things to help her that other people don't know. And so I listened to these family members saying, I wish that I had known. I wish I knew how to navigate this. I wish I better understood what ADHD was. Now, they didn't tie the link in, but all of these families were saying, my child, my loved one had either undiagnosed ADHD or diagnosed ADHD, and they never managed it, which we will also talk about. And then as my daughter got older, into the high school years and even the college years, I quite literally would say when I would get into the car, and again, whether you're religious or not, I'm not even sure I am, right? But I would be like, there, but for the grace of God. If I didn't know what I knew, would my daughter be one of them? And that is when these trainings started, because this is fundamentally one of the most misunderstood, misrepresented, and least treated diagnoses with some of the highest risks. So this was 12 years ago or so that this training started because I was like, every family member wishes they knew what I knew. And I'm not going to keep this to myself anymore. Every school needs to do it. So if you are a school practitioner, if you are working in the school district, every teacher needs to hear this. Every parent needs to hear this. If you or your loved one are impacted by ADHD, you need to hear this because we are a field that focuses in on 88 or on depression and anxiety, which we should. But we're about to talk about how this is a higher risk and no one's talking about it. So we will go through this together. So that's the whole reason. So why this? Why do I love this topic? Because I obviously love ADHD, period. My husband, my daughter, right? My best friends all have it. So I love it. I love the energy. I love the spontaneity. I love all of these beautiful qualities to it. But when it's not managed, it's incredibly overwhelming for individuals who have it. And so again, I'll start sharing some of those stories as we go through this. So here's some of the common myths, right? And then the facts. Because again, because we don't hear about these topics as much, and I will say it's starting to catch up, right? TikTok, which we'll talk about, has definitely made this a little bit more popular. And we'll talk about that because there's good and bad. But it's starting to catch up where people are having these conversations. But are we still having the right conversations? So the myths, ADHD is not a real condition. So again, my husband, I'm not sure if people really believed in it back then. Back in the day, what people would say is, he's just not great at school, right? They're not trying that hard. He's going to be better at doing this. She's going to be better at doing that. And they just dismissed it. If I were to look inside my family, I probably could find a couple of my siblings that also have it, right? So it became like it's not a real condition. But the facts are that is a well-documented neurodevelopmental disorder that has significant ramifications and is understood by the American Psychiatric Association and the World Health Organization. So this is not a made up, right? So I know even growing up when I was, and I'm 50, people would be like, they're just giving them excuses. Flash forward to 30 years ago when I was in this field, somebody with ADHD, they were saying that they're just dismissed, they're just active, they don't care, they're not good students, they're not smart, they're just being bad, right? We labeled all of these things. But this is a real disorder. It has a very strong genetic component, right? So I found out my husband had it when I was like, how the hell does our daughter have ADHD? Right? If I didn't know better, I would think she had it. But like, who has it? It's not me. And he was like, oh, I might. We had been married, right? Like that so again, it can be very successful, but it's real. But we are still coming to terms with what that means. ADHD only affects children. We know that that's not true, right? So this is not something people grow out of, right? So our brain develops, which we will talk about. And so your brain can mature. So the symptoms can look different. but people don't just grow out of it. So if you're a child with ADHD, you're likely going to be an adult with ADHD. It's that we just didn't pay attention to them. And we really looked at it. And again, 15 years ago, people were literally saying you grow out of it. What? Right? That's like telling somebody you're going to grow out of your depression. Right? Imagine saying that to somebody. Now, do people have better skills? Do people know how to manage it better? Do people have, but they're taking their medications? Yes. So then does their depression reduce? Sure. But it didn't magically go away, right? That's not how this works. You don't magically lose your diabetes, right? Like you do things and things change as a result of it. People with ADHD are just lazy and undisciplined. Man, I would be so wealthy if I was paid every time somebody said that to me. So again, I started my career working with adolescents where this was incredibly misdiagnosed. And so all of these young men at the time, which is what I was predominantly working with, were labeled as lazy, not trying, they don't care, and they're just bad. And so people would literally say to me, "You are excusing poor behaviors." I'm like, "Well, first of all, I'm not excusing anything, right? Like I'm not getting, they're not getting away with anything. But I am saying that there's a difference in the way that they are learning and their capabilities than some other child's. And if we don't adapt to the way that they learn and experience the world, then it's going to come at their detriment. That's the shift, right? These aren't undisciplined individuals who are just being lazy. We're going to talk a lot about that brain. So again, for those of you that have done a training with me, you know I love myself some brain. This is critically important that we understand the brain when it comes to somebody with ADHD. Um, and so again, this is an executive functioning disorder that literally goes after the frontal cortex. And again, we're going to talk about that. So, I'm going to go back to a slide as we go through these about some of the symptoms. And when we get there, I'll say it again, right? So our children's, our beliefs about ourselves come at the result of the things that we hear about ourselves. So if you are a child who is quite literally doing the very best that you can and not able to sustain yourself to the experiences of some other child, and people are calling you lazy, undisciplined, you don't care, nobody, you're stupid, you're not smart enough, because nobody's accommodated the way that they learn, then their inner voice starts to say, I'm stupid. I'm not good enough. I'm never going to be smart enough. And those are the places that comorbidities start. So when we start to talk about like ADHD and depression and anxiety, if your voice, your inner voice keeps saying to you, because the world keeps telling you, you need to fit into this box, then your message to yourself is that I'm not good enough because I was trying. I was doing my best as this child. I was trying to sit still. I was trying to read this book. I was trying to focus in on this, and everybody's telling me I'm not doing it successfully. And so when I go out to the schools, I say, imagine telling a child that is visually impaired to read a book. And then when the child says, I can't read the book, I can't see it, us continuing to say, all of the other children are able to read the book, so what's wrong with you? You need to just read the book like everybody else. And that child's like, I am visually impaired. I can't read the book the way that you are telling me to read the book. But the world keeps saying, then you don't care. You're not trying as hard as the rest of the world. You don't want to be smart like all of the other kids. We would never do that because we would recognize that a child that has a visual impairment needs to have accommodations to allow for their academia to improve based on the way that they learn. But when we tell a child with ADHD to sit still, to sit for 4 hours at a stretch, to read a book, to pay attention to all of these things, and they can't. The way that I used to say this when I worked in the field was children would rather be bad than stupid. You tell a child that isn't physically capable of sitting still for that long to sit still, and if you don't, it's because you are unmanaged, you don't care, you are bad. Eventually they choose bad. So having that and listening to the way that we communicate about it becomes incredibly important. Myth, Number four, ADHD is caused by bad parenting or too much sugar. Stop it right now, right? So that's like very old school. Like if your children were misbehaved or something was going on, we were immediately blaming the parents. It used to be bad moms, right? So we've come a little bit that we no longer just blame the moms. Now we're saying it's bad parenting. But as I always say, bad parenting doesn't cause ADHD. But I will say ADHD can cause some bad parenting moments, right? Because we change as a result of trying to streamline this. So some of my shining moments were not in my ability to be able to uh, navigate some of this with my daughter. So it's caused it, but parenting doesn't cause it, but chaos does exacerbate it, right? So there are things that are critically important that we know that their structure, organization, follow through helps ADHD. So unstructured, chaotic environments tend to make it worse, but not cause it. And there's no evidence to say that sugar causes it, right? So sugar has the same effect as for all of us. ADHD only involves hyperactivity, so we know that that is also not true, that there is a very large percentage of those that are diagnosed with ADHD that have the inattentive type. And so they tend to be the ones that people used to call the daydreamers, right? They just never pay attention. I don't know what they're doing, right? So those were the old school daydreamers of the world. So there is the inattentive type. There are more women diagnosed with the inattentive type than the hyperactivity type. Right. So, and there's neurological, which I'm not going to get into, there's neurological reasons for that, right, within hormones. But it also might be that we are misunderstanding how a female presents with ADHD versus a male. Medication is the only treatment for ADHD, so we are going to talk about pharmacological interventions. It is not the only intervention. This is a spectrum disorder, so there are those that have pretty, what I like to call like wicked ADHD, right? And then those that have a very different level of ADHD. So again, it's a spectrum disorder. So medication isn't the only intervention, but it should be a very viable conversation about it. And we'll talk about a lot of what people worry about is addiction risks, right? So we'll talk a little bit about that as well. People with ADHD can't focus on anything. So they must not have ADHD because they can spend hours on their phone. So that's not true. That's not how the brain works. So ADHD actually links to a hyperfocus. So those are oftentimes the children or the adults that have a hard time transitioning. So when you're like, all right, playtime is over, put away your blocks, that's the child that's like, I'm not done. I'm so hyper focused that I need to finish that I'm not completed. And so they end up getting in trouble because it looks like they're being oppositional. As an adult, right, I always jokingly say, for me, this is when my husband says we're about to do this. And I'm like, I don't think that this is the right time. Like, we don't need to do this today. Like, we've got 20 minutes. And he's like, I'm going to do it. I'm like, okay, we're going to do this. So that's the hyper focus, right? So that doesn't mean you don't have it. It just means that their brain gets so hyper focused in a certain area. That's a part of what this is. And then ADHD is oftentimes overdiagnosed. So this is an interesting one because while it is misdiagnosed, I'm not convinced it's overdiagnosed. Now, again, because I specialize in trauma as well, there was a lot of young children when I worked with them that had trauma that was being diagnosed as ADHD. Now, two things can be true, and they could have both, but a lot of what the symptoms were trauma related. So the way that I would help tease, and again, lots of trainings and conversations and talking to families and the individual themselves, but the way to tease things out is that trauma is episodic. Trauma is triggered. It looks the same, right? It's hypervigilant. It's which looks hyperactive, right? It's not paying attention. It's daydreamy. That's because they're acutely aware of their surroundings and, right, a trauma response is to assess safety. So the symptoms can look similar, but the root cause is that a trauma is a nervous system protection, right? It's a limbic system dominant response because they're in fight or flight trying to survive. ADHD is an executive functioning, right? It's literally the cortex of the brain, right? Just not getting enough of the neurochemistry that they need. So an easy way to really start to differentiate, again, other than a full assessment and understanding this child's background, right? So I was having a lot of children that were in foster care and they were all diagnosed with ADHD. And I'm like, I mean, if they're in foster care, then they've already had trauma, right? So, but ADHD is the erraticness. Something triggered, or the trauma is the erraticness. Something triggered them and they reacted. ADHD is consistent. It shows up everywhere. It's with them every single day. It's with them every single night. It's at school. It's at home. It's out, right? So it's chronic. That's a very quick difference. So pay attention to the history to make you a little bit more like, is there something else going on here? Trauma is episodic. ADHD is chronic. So here are some fast facts before we start getting into the meat of this. Males are almost 3 times more likely to be diagnosed with ADHD than females. Now, there's enough research today to say that might be on us, right? We are not looking because the symptoms look different for females than males. I will say it was a lot harder for me to get my daughter diagnosed eventually, and I waited a while because I know ADHD and I could manage it for her. But nobody was looking because she was a good student and she behaved well, right? She tried the very best that she could. So nobody was really paying attention to him. I had to push. Like, no, I'm telling you, she has ADHD. I literally live in this field that they finally did the diagnosis. So I'm not sure it's because men get it 3 times more likely, or if it's that their behaviors, it presents a little differently. And so we pay attention to that a little bit more. Of the 7 million, so an estimated 7 million children between the ages of 3 and 17 have been diagnosed with ADHD. The average age is 7. Most people will say, why do you think that's the average age? Because that's when you're trying to get them to do full-day school. So it's about to show up, right? When a child has to go to school all day, that's normally where it shows up. If you're working with adults, right? And we'll talk about the assessments that should still be done, but I always look as like a red flag. When I'm looking at the adults, I start to ask them the questions backwards. Like, how did you transition into elementary school? What was it like? How did you get your homework done? Were you able to multitask, right? I'm just fishing around because it didn't start as an adult. Somebody that says that I just developed ADHD, you're like, well, this feels a little bit different, right? This feels like it could be post-acute. This feels like it could be the result of this. You didn't just develop it in adulthood. You had it. And so there should be symptoms for you to be able to see that when they were younger. But the symptoms typically appear younger. My daughter's appeared before the age of 3. I could see it, right? I had to wrestle her to change her diaper. So, and she was walking at 10 months, right? She was out of her crib by the time she was a year. She literally was crawling out of her crib at a year old and showing up in the middle of the night in my bedroom. So it was there. Not just a childhood disorder. So this is again where we have to pay particular attention as we start moving into the SUD world, right? Or mental health world. Approximately 6% of adults currently have a diagnosis, which translates to 15 million. All right, that's a lot. ADHD is 5 times more common among adults with alcohol use disorder than those without it. So now we start walking into those risks. Approximately 25% of adults who go to treatment for alcohol and substance use have this. Now, we're going to get into this a little bit more, but when I say, if we think about approximately 25%, and we probably could argue it's a little bit more, I always ask people, not today because we're on a webinar, how many of you have that on your treatment plan? So most people have anxiety, which you should. Most people have depression, which you should. Most people don't have ADHD. And if you don't manage their ADHD, they can't manage their recovery. So you have to give them skills to manage the ADHD for them to be able to manage their recovery. Because when we start talking about those vulnerabilities, you don't manage the ADHD, the impulsivity is going to beat the addiction anyway. They could have every ounce of relapse prevention skills, and the impulsivity is going to perpetuate the chronicness of their substance use. So you don't treat that, they are an uphill battle. And then because they have lived a life where they have consistently been shamed for having a disorder that nobody really understands and told them they're not good enough, they blame themselves. So I mentioned very quickly, I'm not going to get into TikTok. I don't have TikTok, so let me say that very clearly. But I do have daughters, right? One of which has ADHD, who does not watch TikTok videos because she has ADHD. This is very popular right now. So the beauty of this is that we're seeing an increase of those getting diagnosed. I'm going to again go back when we start getting into this about the importance of a accurate, full assessment, not just I can't concentrate, right? Like that's not enough. So it's reducing some stigma, which I love, right? So maybe the stigma around ADHD is getting reduced, but it's also being provided by people that are not professionals. And so the diagnoses aren't right. It's inflating people being like, I have ADHD now. And I'm like, what? Right? So you don't unless you do. And if you do, you know it, right? This isn't a sneaky diagnosis. It's not subtle, right? It's a like, on my hair kind of diagnosis. So I caution any of you as practitioners that if you have somebody, particularly young adults, that are identifying with TikTok, start asking some questions because they're getting misinformation. They might be getting some good information, but they're definitely getting misinformation that can complicate this for them. So I would just say, be aware, be open, have conversations. If you're that type of therapist, I would also have them pull it up. The other piece that we saw is that the questions that have been asked of me is like, how come it seems worse since COVID? Did COVID cause ADHD? No, right? ADHD is a neurodevelopmental disorder, right? Highly genetic. So it didn't cause it. But if you think of what happened during it, structure was removed. Physical outlets were removed. So I know for my daughter who has rip-roaring ADHD, she goes to the gym every day. Every day. I wish I had her discipline, right? That's the superpower. 2 to 3 hours every day. That was single-handedly the worst thing for her. So she bought gym equipment, right? So COVID didn't cause ADHD, but that limitation in your ability to go out, the stress associated with it, which again, stress can exacerbate ADHD. So it flared it. It didn't cause it. So we saw a lot more as a result of it. So if you had it and you were managing it and then all of a sudden you were kind of created. So again, I'm not comparing humans to dogs, but I think I ironically enough have an ADHD dog, a German Shepherd. And so if we crate him for his behaviors are worse because he needs the physical outlets in order for him to be able to get out all of that energy for him to be able to function, right? That's really good for his brain. So it's the same for humans. Here are some of the gender differences. So boys tend to display more externalized symptoms, right? So they are easier to diagnose because they're a little more disruptive in your classrooms. And for this, I will very briefly go over the DSM. I'm not spending time on that because you are all fully capable of reading it yourselves. The majority of what I'm speaking about today is the H, right? So the inattentive type runs risks associated with it a lot because of those comorbidities. So when we talk about like the inattentive type and somebody telling them they're lazy and they're not smart and they don't try, all of these things that are counterintuitive to the brain, that person runs the risk with comorbidities. The H is where there's impulsivity. And so that's a piece that I'm going to be focusing in on, that H, right? So again, just as a disclaimer. So for those boys, again, you tend to see the acting out and the impulsivity, the hyperactivity, right? The inability to sit still, the inability to not like be jumping and moving all the time, all the time. You see them kind of scooting around. The lack of focus. So those are what the symptoms tend to look like. For girls, it looks a little different. It can look a little more inattentive. This is where you hear somebody say that they're the more daydreamers, right? They are a little bit more socially withdrawn. They might have a little bit more anxiety and their self-esteem. Because again, if we're looking at the way that we connect as we grow, right? Boys connect through activity. So that's fantastic for somebody with ADHD. Girls connect through communication. Long, chatty conversations. So when you talk about adolescence, for a girl, their anxiety and self-esteem get tapped into because they can't connect the same way. They can connect better with boys. Girls want to have long conversations about their feelings, about things that are going on in school, about friends, about social, different things. But a girl with ADHD can't connect in that same way. And so it feels like there's something wrong with them. There's not, right? So again, if I were to use my daughter who has given me full permission, she had girlfriends, but all of them were athletes. Her closest friends were Division I athletes. So that's how she connected. But to this day, if I try to have a very long conversation with her, it's not happening, right? I got a good 2 minutes in me. She's with me, but we do things, right? And she's 28. So that's the difference, right? So that's where you start seeing some of the anxiety and the self-esteem because it doesn't fit the rest, particularly in the social contexts of what we see within our relationships. The trait, the verbal aggression, so they might be more um, inclined to teasing, to name call. So that is a little bit more, which young girls are told to not do that. If a boy teases somebody, we're like, ah, he's being a little boy. But if a little girl does it, it looks like she's being mean. She's terrible, right? But this is a part of that ADHD as well. So when you think of it in the context of parenting, it's incredibly important for there to be space to say, like, these things have to change, but for the child that's receiving it to also understand this is a part of this. In the same way that we would help somebody to understand if your child had depression, that these are the symptoms of the depression, and this is what we do as a family, right? So in the world and couples and all those other things. And then promiscuity, which nobody talks about. So young girls increase in this sexual hyperarousal and they become more promiscuous. And so they once again get labeled. So they have shame associated with it, but it's literally a part of their diagnoses, right? It increases it because for a number of reasons, right? But that we don't accept. So when a boy is like that, we assume like he's just being a boy. But when a girl, we shame her. There's the self-esteem. There's the anxiety, right? And so this is where we also see girls with ADHD also run higher risks of sexual assault and teenage pregnancy because their brain doesn't see the threats. It doesn't see the consequences of these things. And so these are things that also nobody's talking about with these young girls. Puts them at risk for future. So when we start so as I'm saying all these things, pay attention to like, would that be a risk for substance use? Would this be a risk, right? So pay attention to those things because that's what this is showing. So here's where the complications come in for ADHD and substance use. And again, I'm going to break it up. So when we go through this, I'm going to talk about the brain, right? We're going to talk about the young adult brain, and then we're going to talk about how substance use falls into all of this. So it all trickles together. So we understand why all of these things are connected. So again, about 50%. Let me say that one more time. About 50% of those with untreated ADHD develop a substance use disorder. That is higher than depression. That is higher than anxiety. And yet, as a profession, we still don't talk about it. 1 out of 2 who have ADHD run the risk of a substance use disorder. That people should know. That's what started this whole training because I knew that. So the conversations I had with my daughter were very different, starting from like 11, because I knew how her brain would respond in the event she started to experiment with a very impulsive brain, right? So people aren't having those conversations because they don't know. Today we are going to know. Today we are going to share that with families. And if you are working with children and adolescents, this is the day to start having these conversations with their families because everybody should know. You deserve to because you love somebody with this amazing superpower, but they need to understand the risks associated with it. 33% never finished school. So again, you think about back in the day where they were like, Johnny just dropped out of school for no reason. Johnny probably had ADHD. I mean, we could argue that, right? So these aren't individuals that don't know how to do well. Typically, they're brilliant. They can't get through school in the way that we are looking at it. 46%. So again, almost 1 out of 2 untreated boys end up with a felony by the age of 16, right? Ooh, that's a big one, right? Compared to 11% of those that don't. 21% of adults have a felony. If you had ADHD and it wasn't being treated, like, wouldn't that be powerful for you to know? Like, oh boy, I actually should pay attention to this. Right? So the way I used to always say that is like, listen, you got ADHD. Let's grieve it. Let's acknowledge it. Let's do what we need to do with it, but it's here. And here's the thing about ADHD. You're going to manage it or it's going to manage you. Those are the only options. So you want to ignore ADHD? It is like, no, thank you. Hold on. Let me catch this felony for you. Right? So you either manage it or it manages you. That's it. Those are your only two choices. That's how clear I am when I'm talking to somebody with ADHD. Those are your only two choices. 75% have interpersonal problems. So here's again the depression and the anxiety because it's filled with conflict. Their brain literally gets stimulated by the conflict that they have with their family. So think about how terrible that is. I connect through the conflict because it's so exciting to my brain, to my siblings, to my parents, to my spouse, right? About 25%, I think we're being cautious here, of those that are incarcerated have ADHD. I think it's higher. 40% more likely to have divorce. So when I do these trainings, that's almost one of the biggest things that people take away. They were like, wait a minute, is this why I divorced? Is this what's going on? Yeah, right. If you are with a spouse that doesn't understand ADHD, ADHD is a handful. It is. I love it, but it's a handful. 8 times higher of accidents, speeding tickets, and a revoked suspended license. So this is again, daughter gave me permission. This is a funny one. So she almost had a suspended license because she did get a speeding ticket. And you know what she did? She forgot to pay it because that's what ADHD is, right? That I'm like, did you pay your ticket? And she's like, no, I forgot. And I'm like, all right, we'll pay it. And then she didn't. And I was like, did you pay your ticket? And she's like, no, I forgot. Right. So there's tactics to do that. I was like, in this very second, you need to pay it right now in front of me because you're going to forget it. It's like in the back of your brain closet, right? With ADHD. So that's why these aren't individuals that are worse drivers. They do things are a little more impulsive. So they speed. The revoked licenses and suspended licenses oftentimes the I forgot. Hmm. You're like, fair enough. Here's the truth about ADHD. It is a chronic neurodevelopmental disorder that affects the development of the function of the brain. That's it. There's nothing wrong with the brain. It's not broken. It's just changes in the neurochemistry. Just like there's nothing wrong with somebody that has diabetes, and there's nothing wrong with somebody that has depression. Their biochemistry is different. So that's what it is. Yeah. So I mean, we can process your feelings about your diabetes, but you're going to need to change some things in order to be able to manage your diabetes. This is a neurodevelopmental. Less than half of those that have it are actually treated. That's a shame. One of the most common childhood risks or disorders, yet the highest risks. So this is again, if you're in the school system, start screaming this on the top of your lungs. Many with it are not hyperactive, so they don't get diagnosed. And again, just in case people are like, this still feels like it's not a real diagnosis, it's been clinically researched for well over 40 years. It's real, right? We're past that. We're not doing that. And treatment can be incredibly effective. So in my private practice, that's why I always said I like doing ADHD and trauma because trauma is slow work, right? Which I love and I appreciate. ADHD, ooh, it feels so good. You start doing interventions and it starts to work really quick, right? It's those secondary comorbidities that you have to play up and catch up with, like the depression and the anxiety. But when I work with somebody with ADHD, it is quick. So if you're a therapist that's like, I love immediate gratification, terrific, do this because that is what's going to be the difference. Because as soon as I start making interventions, their brain responds really, 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 really quickly. Speaking of ADHD, my ADHD dog just broke in. So I hope that there's nothing that he barks because he's not allowed upstairs, but somehow figured out a way to escape and get upstairs. So my husband must have left. So here's the overview as we start to navigate through this, right? And so I will say again, full permission, this is a tattoo that my daughter got. So for years, she did not want to acknowledge that she had ADHD, probably because she had a mom that this was what I did, right? So she doesn't want to hear from me. But she got this because she said, this is the perfect representation of the beauty and the chaos. There's this beautiful woman, but that's what it feels like. So as we start to navigate in the understanding of the brain, this becomes so important for us as we continue to service those either young adults pre and don't have a substance use, but especially those that do, and adults for that matter. If you work with first responders, guess who else has a lot of it? So when we look at what the reality of it is and what it looks like, is that I always would say to somebody, are you the person that jumps into the fire and then is like, oh, I shouldn't have done that? You start asking those kind of questions and it starts to pop up, right? Where they're like, I do that, right? I had a young adult who, this is a great story, a beautiful story of ADHD, right? So he is on probation for substance use. And there was a police officer that was patrolling the neighborhood. And he got annoyed that there was a police officer patrolling the neighborhood. And so he confronted the police officer and was like, what? You think I've got drugs on me? You think, search me. Here's the beauty of ADHD. He did have drugs on him. And so what he did is he encouraged a police officer. He challenged a police officer for the behavior that he actually did have. I'm like, why? What are you doing? That's I didn't think through that one. Yeah, that was regrettable. I didn't think through that all the way. So that's like one of the easiest questions to start with. Do you do things that you later regret that you're like, why did I do that? That's a first question because it's based in the poor decision-making skills. They don't think through the consequences, right? They're so impulsive and then they don't see forward with like, oh gosh, if I tell this cop to search me, I actually do have drugs on me, right? So it's different. The interpersonal difficulties with the families and the friends is again the impulsivity and the way that they're engaging, right? Poking, getting streamlined for their behaviors. Um, it has a high prevalence of first responders. So that is also something to pay attention to, right? So the beauty of this is that it has the ability to be able to take on these very stressful jobs, these very stressful careers, because they can manage their brain in a way that allows them to see better behavior, right? So those are really important pieces. So if you work with first responders, what you tend to see is cocaine and alcohol, right? Which we'll talk a little bit about in those kind of risk factors, but cocaine and alcohol, because the cocaine in those moments actually works. I know my mic is, I don't know why my computer is glitchy. So I did see that. I don't know how to make it less glitchy. I closed all my apps and everything for you guys. So I apologize. I don't know. I don't understand why it's glitchy.
I think you turned your computer video off once and that did help. It's not that
Okay.
bad, but maybe if it happens again, we'll just have your video off.
Okay. Let me know if I need to turn off the video,
Okay.
but I do apologize for that, everybody. And then the last piece is that it's incredibly successful when it's highly stimulated. So when you think about people with ADHD, when they are highly structured, when they are engaging in things, that's incredibly stimulating for the brain. And so they function the best. So if any of you remember Michael Phelps, who is starting to get dated, right? But one of the most medaled Olympians in the country, in the world, right? He was able to channel his ADHD. But if you read his story, his mom put him in swimming because of his ADHD, because he was a handful, because he was running around, because he was active, he was getting in trouble in school, and she targeted it. When he stopped swimming is when he got in trouble. So if any of you remember, he stopped swimming. He ended up in a treatment facility, right? He started smoking marijuana, he was drinking. So all of these things. So a very challenged brain, which is part of the beauty, is a very successful brain. But when it is bored, a bored ADHD brain is not the best. And this is what we see time and time again. All right, so here's where I'm not going to go over the DSM, but I do have it in the slide, right? So you can see it. So in order to have the accurate diagnosis, so not just somebody saying, I can't pay attention, right? I don't like to read. These are that they have to have these characteristics, right? So in the inattentive type, this is what they need to look at. Again, keep in mind, this is chronic. It shouldn't only show up at school. It shouldn't only show up at your house. It shouldn't only show up. It's a chronic disorder. You should see it look differently. So in school, when they're required to sit longer and be task oriented for a longer period of time, you might see the symptoms more than at home. But at home, there's no hiding that the behaviors are there as well. right? They just have more opportunities to manage it at home. The hyperactivity and the impulsivity, so not everybody has that part, right? The impulsivity is a different beast. So that's where you see something different, the inability to stay still, right? So when I would talk to families, I would say, is your child or to the child, are you the one that like constantly had to sharpen your pencil, right? You literally take your pencil, jam it into the desk, break the point, and then go sharpen it again because you're trying to find ways to not get into trouble, but you need to get up, right? So those are some of the things that you can say. Leaves the seats, right? On the go, driven by a motor, right? All of these things that can potentially be these superpowers. There are some questions coming through, so I'm going to answer those questions. As soon as I get through these, I will answer those questions for you. So again, to the diagnosis, does not follow through on instructions, difficulty organizing tasks, loses things, is often distracting by external stimuli, right? All of these things are a part of it. Some talk excessively, some don't talk at all because they've learned that their voices are kind of too fast, right? Too frequent. It's definitely going to present younger. So if you have an adult that's saying, I was diagnosed there, I would do some more assessment to just ensure that this wasn't present already. Because when they engage in substance use, oftentimes what you see is that that was their attempt to mitigate the symptoms of ADHD, which we'll talk about when we get to that substance use. And so when we think of this, this is the easiest way, again, when I'm talking to individuals, right? So these are things I say to my family. So again, I've already said very loud and clear how much I love ADHD, right? Married it, raised it, surround myself with it with my best friends. This is literally where I will be having a conversation with my daughter who will ask me a question. I will answer her and she'll go, "What?" And I'm like, "What?" And she's like, "What are you saying?" I'm like, "I'm answering you. Where'd you go? Did you see a squirrel?" And she's like, "Oh yeah, I saw a squirrel." Right? So that idea of like your attention just wanders. Her attention wandered so quick, I was just answering her question. She brought me into this conversation, not me. Right? So it's so quick that their attention just wanders off. Forgetting, right? So do you have difficulty completing tasks? This is where procrastination comes in, right? I forgot. I just didn't even think about it. Or they wait till the very last minute, right? Which we'll talk a little bit about. Paying attention to details, right? So I ordered a large, but a medium came in. So I must have accidentally done it. The details of like packing. So if anybody's ever done that, I had one person that I worked with that they came home without their clothes. They packed some of their clothes, but they forgot like all of their shorts. They forgot them, right? And so these are those moments where it's funny. And if we can laugh at it, we can laugh at it. But what happens oftentimes is that you come home and you've forgotten your shorts. And it would be a normal thing to be like, how'd you forget your shorts? Like, how did you forget to pack six of the shorts that you brought there? But keep in mind, the inner voice is what they internalize from what they hear. Because when you say that, doesn't it sound like, why are you so stupid? Like you didn't pack your stuff? Like how does somebody do that? That's so stupid. It's not. They're not paying attention to those details. And that's what happens as a result of it. So sure, they literally came home from a vacation missing half of their clothes. Yeah, that happens. It is a little funny, right? But laughing with it is different than shaming it. Losing things, so they lose their wallets, they lose their keys, right? Um, Too many risks, right? Or too many tasks. So this is another one that I tend to ask on when I'm working with families. If you were to tell your child to go upstairs, grab their backpack, brush their teeth, and put their sneakers on and come downstairs, what happens? And both of them typically will start laughing and they were like, he'll come down 20 minutes later in his pajamas still. And I'm like, okay, so let's dig into this one a little bit more, right? Because the multiple tasks are incredibly difficult. For us, for my daughter growing up, we had a stop sign at the door that said, did you grab your lunchbox? Do you have your flute? Do you have your backpack? Because time and time again, she'd go to school and we'd get a phone call. I don't have my lunch. I forgot my backpack. I forgot my, right? Like, how did you forget your backpack? Right? So those kind of things, too many tasks, it overwhelms the brain. Hyperactivity. So are you restless? Right? So again, that's going to be the child that this is what I love about it, right? It's super fun, is that they're not going to be able to sit idly. So for a lot of families that they might have a child that can sit idly, to have an ADHD child going out to dinner, unless you're doing things actively with your child, it's going to be too much for them. For an adult, doing things that require a long sustained amount of time might be too much for them. So physical activity is going to be a lot better, right? Because they need to keep doing things. They're not going to pay attention to the conversations, right? Their brain is going to go to other places where they start thinking of other things. Impatient, pretty pretty regular with an ADHD, right? So the long line, traffic, right? All of these things that annoy most of us, but really activate somebody with ADHD. And forgetful. They're supposed to show up with something and you're like, hey, where is that? And they're like, oh, I don't remember it. I forgot. My bad. So all of these things are pretty normal. And then you add the impulse control, right? So these are the things. So as I'm saying these things, we're making light of it because we should, right? Because it's okay. This is normal. But pay attention to the risks associated with these things, right? So struggling with time management, impulsivity. Are you a reactive emotionally, right? Very strong emotional reactions in one way or another. Do you take risks? Are you the first one? So a bunch of friends start to plan something that would be funny. Are you the one that says, I'll do it? Do you struggle with organization? Keep in mind how these are all critical things that somebody needs to maintain recovery. Do you struggle with rule governed behaviors? So these are the rules. This is what you have to do, and this is how you need to do it. Right? In my house, we used to call stop signs stoptional. Right? We didn't all call it that, but we know who did. Right? Right? And then the messy, the unorganized piece. Right? These are some of those things that increase the risks that we need to pay attention to. And if we don't treat it, it's going to come when the substances are removed from their systems again. All right. So this was a really funny video. If you haven't seen it, I'll send it. Callie can send it in the link, but I can't get the audio to work. So we won't send it. But it is a cute little video um, that talks about ADHD. It's just a funny way of looking at it. So I'm going to hit some of those questions because you have a lot of them, which is fantastic. Any tips on how to tell when someone who definitely has trauma also has ADHD? So, yes, you can work on both of those two things simultaneously, right? But you have to figure out which symptoms are tied to which. Because hyperactivity in a classroom that is actually a survival skill, that you need to address the survival skill, right? So you can get somebody organized for the ADHD, but when you're working with those two things simultaneously, trying to figure out when it happens so that you can provide the right regulation skills and the right interventions. But to ask a child that doesn't feel safe to use their cortex to be able to complete math, right? That organizational piece can't come first. So it really is looking at like the symptoms. So it's just paying attention. I mean, that's what I normally will ask is like ask the teachers. If it's a child in school, if it's at home, pay attention to when the things happen, pay attention to what preceded it. Again, ADHD is chronic, trauma is episodic. People with substance addiction screened for ADHD? Most are not. No. I often see other diagnoses you mentioned. Yes, there are a lot of easy diagnoses, the BAM, the PHQ-9, the GAD-7, the PCL, right? So we test for all of these other things. The ADHD one is not historically tested for. Now, if you have somebody that has already been diagnosed with it, right, you could. There's other scales that you could use that are versions of it that would just test for some of the impulsivity. But again, we don't really have a standardized one that would make it easier and accessible, particularly in a behavioral health space. But if you're in an outpatient, there's plenty of scales. What are the proposed reasons for the higher promiscuity in girls versus boys with ADHD? Well, I think we could just say the words, right? So I don't know if that boys are engaging in less sexualized behaviors. We just say that that's boys' behaviors. I think we call it promiscuity for girls, right? So the behavior is the same. We just say that girls shouldn't be doing it and boys are allowed, right? Boys are being boys. And so the sexualized behavior, I mean, I always thought that it was ironic, right? So we're really angry at this girl that got pregnant, But you're like, a boy had to be involved in that, right? She didn't get pregnant alone. So why didn't he use anything? So that's kind of where this is. So there's no higher risks for the girls to be promiscuous. It's that we don't like it when they are, right? And so we shame them. But the behavior is the same. So the reason why there are more, um, oh, that was it. So the higher promiscuity. So yeah, I'm going to say boys have some of the higher risks as well, but we don't mind them, right? Boys are allowed to do whatever they want sexually. Girls are just, you know, shameful. Shame, shame. So we label it differently. Can ADHD also lead to asexuality and or frigidity in adult women due to inability to relate to others? So, and pornography dependence. So you're looking, I mean, there's complications with that, right? So again, we're looking at some risk behaviors that that could have some of the addictive qualities, right? So could porn be a part of that? Sure. When we're looking at the relationships, so there are links and not entirely. So for a long time, they linked the two. They said ADHD and autism were basically the same things. And that is ridiculous, right? But there are links within autism, which is also a huge spectrum disorder, and then ADHD, two very separate things that just happen to sometimes have an overlap. So what you see too there, and I don't know quite as much about that, is I could see, based on my understanding of both, that if you struggle with social, so girls with ADHD don't necessarily struggle socially, they struggle with how to connect. So they're engaging socially, but it should be through action, less let's sit down and like chit chat, right? So like that's where the anxiety and the depression can sit in, but there are some that socially don't have the same bandwidth, right? They don't have the same reading cues. They don't feel like they want to be as socially engaged. And that might be a little more on the autism spectrum. And then I could see where intimacy and pornography can connect, right? So what we do see though in just general with pornography, and again, I won't get on a rabbit hole with this, is the lack of intimacy in there as a family therapist and a couples, that then impacts their relationships, right? Because this is a false way of seeing sexual behaviors that then impacts the way that somebody engages in sexual relationships with their loved one. So those are some of the risks, right? So, all right. Any information on treatment and whether it would be helpful for ADHD and substance use? I don't know that one quite as well, so I don't want to speak to something I don't know as well. We'll talk about treatments. Um, and stimulants and non-stimulants as well, let alone the behavioral intervention. So we'll get to that. Wow, this is a topic and a half. I'm going to have to do part two. So when it comes to ADHD and trauma, how do you tell the difference? So we talked a little bit about that. Again, chronic and episodic is going to be a huge determining factor. A full assessment is going to give me a huge determining factor based on their history. If you have a history of trauma in the family, start with that. I need to assign safety in order to be able to do any of this other work. So if you've got a patient that you've done the history and you know trauma lives there, then start there. Start with the trauma-informed approach. And then you can start adding in the ADHD. But if you try to do ADHD work before safety is ensured, you're not going to be able to get either. And that's where schools, right? So I've done a lot of trainings with like DHSs, Child Protective Services, right? I've done a lot of trainings with them. And that was exactly the training. Here's trauma, here's ADHD, or here's what we do for either. Yes, the private practice, I will, because we'll do that towards the end. Treatment recommendations, we'll talk about treatment recommendations towards the end. Please comment on addiction to porn as a result of ADHD. So I think I just did. So if I didn't answer it well, let me know. Um, and best ways to talk to the family. So we'll talk about that as well as we get to the interventions. Great questions, everybody. Thank you. Uh-oh. All right, sorry, I had to skip it. All right, so here's the thing. ADHD truly is a superpower. So if you don't believe that and you're working with ADHD, they likely piss you off. So I encourage you either to figure out a way that you love them or refer them out because they don't need anybody else that doesn't love them. And so ADHD is an amazing, amazing diagnosis, right? It is profoundly intelligent, right? It is creative. It is thinking outside the box. They are oftentimes incredibly athletic. They are spontaneous, they are fun, they are adventurous, right? All of these wonderful things. They are oftentimes our CEOs, our first responders, our artists, our musicians, our athletes. They are all of these amazing things. But you either manage it or it manages you. So with all good superpowers, it's going to be used for good or for bad. They have to decide, right? But you genuinely, like, this is an amazing opportunity. And the beauty is that oftentimes somebody that has ADHD finds a balance, right? Somebody that is like, stop that right now. Like, that doesn't seem like it's going to be a great idea, right? So being able to tap into this, because all of the things that they need to adjust, the flip side of it is this, right? But, and again, I can utilize thousands of patients that I've worked with who thought that they were not smart, who were brilliant, right? So I'm going to use one example of a young boy. So he was probably 11 to 13. Families came to me because of his behaviors, right? And he was sent from a school. I start working with him due to his behaviors. He's 13, so I'm not doing sessions without his family, right? He's too, we're all here, right? Like you're a little one. So we're all going to work together because this is obviously a systems thing. And so what we find is that he engages in a lot of behaviors that are ADHD and the family doesn't understand it. Here's a sidekick. Mom's anxious, right? So I can't think of a worse combination of an anxious mom and an ADHD child, right? Because mom's anxiety gets worse because this little one is acting out with all these ADHD impulsivities. And so here's where I say the creativity and the genius, and you have to love it and appreciate it to really be able to continue to work through it. So he's doing well. He's got ADHD. We're killing it, right? I'm killing it. People, they're like, this is so great, right? I all of a sudden look like I'm amazing because he's doing well in school. He's doing his homework, right? We've got all of the ADHD stuff. And then they come in and everybody's really angry. And I'm like, uh-oh, what's going on? And so family is like, he's gone back to all of his old behaviors. He's not listening. He's manipulative. He's sneaky. He's doing all of these things. And I'm like, oh, uh-oh. So what happened? Here's the genius. And this is why you have to ask these questions, right? Because there's little genius in there. Here's a young boy that we had decided was only allowed a certain amount of time on the computer because he did not have that shut off valve, right? He couldn't transition. And so it was impacting his school. Everybody agreed he was fine. So he had his weekend that he was allowed to utilize the time on his computer. Super excited about it, right? He gets 2 hours, I think. And so he went to get on the computer. Mom and dad left the house to go somewhere. He gets on his computer and it needed an update. And the update was going to take at least 45 minutes. Oh, right? He's like, I only got an hour and 15 minutes. So he went up to his attic and he rerouted the computer so that all of, I don't even understand it, right? I'm not a tech person, but all of the updating, the energy shot to his computer. So when he went downstairs, it literally took 10 minutes for his computer to update. And then he got on his games. So the family came home and he forgot. But because he's so used to getting in trouble when they said, because then they went to try to get on their computer for work and it wasn't working. And he lied. I don't know why. But I was like, when they said all that, I go, I don't mean to dismiss what we have to talk about, but that is genius. I'm like, do you hear what your son just did? Your son knew to go upstairs into the attic, reroute the computer so that he could get onto his computer. Because what he was trying to do is stay within the time limit that you said he had. He was trying to be good and then he forgot. And now he lied as a result of it. We'll get to that one, right? So, like, that's what you have to pay attention to when you talk to somebody, because otherwise it just looks like they were disobedient, oppositional, but there's genius in there. And I needed the family to see he actually was trying to do what you asked him to do. He was staying within the 2 hours, but he was getting robbed of 45 minutes of it. And his genius little mind figured out a solution that none of us would have thought of. That is impressive. We'll get to the lying, but we know why that exists because he's used to failing you and he doesn't want to get in trouble. That's a bit impulsive, right? So that was our shift, right? So when we look at the core issues of ADHD and substance use, impulsivity, poorly regulated activity, right? So they are highly dysregulated. Distractibility, disorganized, diminished gun, all of these things, when we say, all right, well, off you go. You got to go to IOP, you got to go to PHP, you got to go do follow up with your probation officer, you got to do all these things. Think of every one of these things that if they don't have the ability to manage their ADHD, they're not going to be able to follow through with their recovery. So we're like, they got the relapse prevention plan. And I'm like, he doesn't know how to use his calendar. He's going to show up late to group. He doesn't know he needs to get on this bus to get to that place to get to your treatment facility, and it's going to take 45 minutes. So when he fails, he's going to use a substance again. So I'm not even sure that the substance is why he ended up having a reoccurrence. I think the ADHD, right? So, and that's where research is starting to show. You treat the impulsivity, you're going to treat the addiction. You treat the addiction and you don't touch the impulsivity, they're going to keep using. So here's some of the etiology. When we talk about it, highly genetic, which we are going to talk about. So some of the other things, and so I'm not going to go into great detail, right? So we know, again, plenty of research today, especially that shows the link within the genetic component, and we will get to that. Some other things that have been identified, but have not had a strong correlated link, right? But could it be? So we have a correlation. Is it a causational relationship? That's where there's still research that needs to be done in ADHD. So if you're on this call and you happen to be a researcher, this would be a great one. Oxygen deprivation. So there's been some research to link somebody that has had oxygen deprivation at birth. And so that's a link, right? So paying attention to it. I'm not a researcher, so I'm not, looking at some of these things, but these are what we see. Brain trauma, so early trauma to the brain. Food allergies. We know that food has a link to it. Do I think that food allergies created ADHD? That one is a little bit looser. Some have identified, like, is there exposure for lead? Because we're seeing that for some young children who were exposed. But again, correlational and causational relationships are incredibly important because what they also find is that those that were exposed to lead also tend to be underserved communities. And so then are we looking at trauma, right? So I don't know, but worth at least exploring, right? So as we're trying to navigate through this and understand this better, these are all things that we should be taking into consideration and still exploring. And then infections, so early brain infections that could have led to some of the other things that increase, because it's all neurochemistry, right? ADHD sits in the neurochemistry, and so all of these things have the potential to change neurochemistry. Here is the genetic aspect, right? So inherited, so between 57 and 97% means the closer the genetic link, the more likely, right? So that's where when I was saying for my daughter, I was like, I don't understand. And my daughter has ADHD. Like I am making it up because that's what I work with. Um, and then my husband was like, I have ADHD, right? Years into our marriage. So if a parent has it, they have a pretty high percentage of also having it, right? So 25 to 30% of fathers, 15 to 20% of mothers, identical twins, obviously you're looking at a very high percentage for identical twins. So this is how we know this is a genetic component to it, right? This has genetic elements that kind of come through. And so a child with ADHD, so the siblings, it's 35, females is 15. And again, when we talk about that for the females, I still want to say cautiously, I think that there's more women with ADHD than we are identifying right now. I just think that they are presenting differently and that they are less likely to come forward with the impulsivity and some of those other things because I think we're still a society that shames them. All right, so my favorite part is the brain. So here's what we're going to do. We're going to talk about that brain. I'm going to talk a little bit about the young adult brain because now we're going to talk about so what happens when everything comes together. So in the young adult brain, which many of us already know, right, there is rapid change. So our brains today, we understand it doesn't develop until roughly the ages between 25 to 28. If you have ADHD, that delays the development of the brain, right? So you're looking at more like a 28 for an ADHD brain to be fully developed. Does that mean not intelligent? No, we just talked about that. They are typically brilliant in their lives, right? So in whatever area that they are brilliant in, but they are typically brilliant. But it means that those pieces that we just talked about, the organization, the inattentive type, the hyperactivity, the impulsivity, that's the part that it takes till about 28 to start to finish, right? So that's the shift. So in these younger years, that brain is rapidly developing. And so when we look at the adolescent brain, as it continues to develop, right? So there's a couple of stages, these called critical periods of the brain that are supercharged parts of the brain development where there's a lot of pruning happening, right? So like you think of like 3-year-olds, right? Where all of a sudden you're like, that's why they call them the terrible threes, because their brain is just saturated with all these neural connectiveness and they've got to add these neural connections and then they prune them away. And so it's a lot to go on in a little brain. And that's why those 3-year-olds are like always like, right? And then the brain prunes a little bit, it settles, and then there's another growth period. And so adolescence is one of them. This is incredibly important, particularly as you are working with children and adolescents and those young adults, because this idea of this use it or lose it concept is that the neural connection, so our brain communicates through all the neural activity, the neural connections that we use the most get strengthened, and things we don't use because the brain can't keep up with all of the neural activity, it prunes away. So for an adolescent that starts to use a substance like alcohol and marijuana, not going to get on that soapbox today, but I sure could, right? So for an adolescent that starts there, adolescence is about dysregulation, right? About high emotionality, about trying to problem solve, all of these things. And when you think of somebody with ADHD, right, magnify it. If an adolescent doesn't use their brain's coping skills, so I use mindfulness, I do exercise, take my medication, I practice these organizational tasks, right? I write down my goals and then I check them off each day. If they don't use those neural connections and they use alcohol or marijuana because they feel like it helps their brain calm down, or I feel like I can focus, right? Cocaine can do that, then these things of the brain that are the parts of the neural connection that we want to get stronger get pruned away. And the connections that are reinforcing the using the alcohol to feel calmer, using marijuana to stay focused, those things, they get stronger. So the thing about an ADHD brain, and I say this to people all the time, your brain is in the gym all day, every day. That's what makes this a superpower. You have the capability of doing things that I can't do. Because at the end of the day, my brain is like, right, I'm done. But an ADHD brain is still going, going, going until they're done, right? It's like there's not a slow warm down. It's like, I'm good, done, right? I need a wind down. But if you go to the gym every day and you only work out your arms, then your legs never get stronger. You're in the gym, but your legs never get stronger. And so that's what happens with this pruning period. If you are using skills that are not adaptive, if you're using substance use, if you are engaging in these impulsive behaviors, then those get stronger. And the ones that you need have been pruned away because they were like, we don't use those coping skills. We use these. That's what makes this brain more vulnerable, because those are literally pruned away. Now, does that mean it'll never come back? No, because our brain is incredibly plastic. So you always have the ability to grow and reconnect neural connections. But that's why it's different when you're working with a young adult than an adult brain, because they don't have these skills because they've been pruned and now you're having to build them. That's why it can be frustrating. So when we look at the developing brain, you can quite literally see, right, from the very bottom where you see all of these different connections and how the brain is organized, right? Those images, the prefrontal cortex is the last part. So the blues are the prefrontal cortex, right? That's the last thing to finalize. So all of those other sections are the ones, and so this is just what it is. So I don't need to be angry at an adolescent or a young adult. They just need to understand their brain, that you can use And this is where, again, I'm not going to get on my soapbox, but when you talk about marijuana, that is the number one substance being used today with adolescents and probably young adults, they're using it as a coping skill. That runs their risk of addiction. So, do other people end up using marijuana and they don't develop an addiction? Sure. But for somebody that's using it as a coping skill, that they need to use to go to bed at night, that they need to use to be able to study, that they need to use to be able to focus, that they need to use to be able to, then the parts that their brain would have done that would have gotten them to stay focused, the things that they would have had to be task oriented, that they would have had to be organized, that they would have had, those things get pruned away. And then they become magical adults, and we're like, they're adults, they need to figure it out, but they don't have the building infrastructure to do that. We have to do that. So as therapists, as families, you have to become their frontal lobes to help to develop their executive functioning. That's why family involvement is so critical, because you need the families to step out and to help them to develop those frontal lobes. Otherwise, they sit in that limbic system, and that's the part of the brain that gets stronger and stronger. Their frontal lobes, literally, no exercise, weak. And the limbic system becomes so strong that their legs are huge, right? In a metaphorical, that's the shift. So they need to understand what is happening. And this is what makes them so vulnerable. The risk taking and intensity, the arousals, sensation seeking, that is all normative behaviors in just regular development. Because adolescence is supposed to be these things, right? The whole launching of like going from a high school to college, moving out on their own. Think about how much risk that takes to do that. So the brain is literally developed to get those adolescents to be able to sustain the risk. You need to take risks. You need to be impulsive. Like you need to not see the consequences because we need you to take these steps. That's quite literally the developmental task of an adolescent. But if it's not managed and you add ADHD, it goes the other way. So now we look at ADHD in the brain. So here's how it affects the brain. Prefrontal cortex, right? So functions as the intersection. So the prefrontal cortex, basically the way that we problem solve, think through our consequences, weigh our choices, right? Engage in relationships. It's the part of your brain that's supposed to be able to suspend your impulsivity. You know, that when we have a thought, you know what, I should tell that cop that search me. The prefrontal cortex is like, stop it right now. Like, you're not going to do that. That is ridiculous, right? But if your prefrontal cortex isn't working, you already did it. Here's a kid that literally is like, search me. And then is like, why did I just say that? Why did I tell that? Right? His friends are like, dude, why'd you just say that? So the prefrontal cortex is also supposed to help you to like impede that impulsive. For parents, when I'm working with children and adolescents, I'm like, you're their prefrontal cortex. So you have to start setting those things up. In my family, I joke, my second daughter is my oldest daughter's prefrontal cortex. My oldest daughter, super fun. She's like, let's do this. And then I got my middle one that's like, hold on. That looks dangerous, right? Literally a conversation that the two daughters just had. Oldest wants to swim with sharks. Middle one was like, okay, like we'll be in a cage. Oldest one, I don't want to be in a cage. I want to actually swim with sharks. Middle one, I don't think we should do that. What sharks are you talking about? Great whites. Middle one, no, we're not swimming with great whites in the ocean. That's not going to happen. Oldest one, fine. Can we sleep? Can we swim in a cage? That's how it's supposed to work, right? That's a prefrontal cortex. For an ADHD, it doesn't work the same, right? When we look at the basal ganglia, that's the part of the brain that helps it to stay calm. And there's not enough. When we look at the limbic system, but as I'm saying this with the ADHD brain, keep in mind what parts of the brain are impacted by addiction. Now we have the limbic system that regulates the emotions. And so this is why somebody with ADHD tends to run high in their emotions, either incredibly sensitive and emotional or agitated and impulsive and aggressive, right? Because that's the part of their brain. Then you have the reticular activating system, which is where the dopamine reward system is. Every one that I just mentioned are the key elements to addiction. So when we talk about the brain and addiction, we're talking about the exact same parts of the brain, literally. This is why they run a risk. So when we look at like the executive functioning, so that's the CEO of your brain, right? That behaves automatically. It helps with focus. It sets your goals. It sets your motivation, right? It strategizes and motivates your behavior. It has like all right, like get up, let's get things done. Let's get these things accomplished. It can be hyper focused on some of the tasks. Now think of if that part of the brain is not working, what parts of these things would interfere with somebody maintaining their long-term recovery? All of them, right? So again, I had a patient a couple of years ago who wasn't showing up to treatment. And I'm like, that's weird. Like, she seems like she's pretty invested in her treatment, right? It's substance use. Um, and so when I called, that I was like, what's going on? What I didn't do is shame her. Like, if you miss one more group, you're not going to be able to come and do these things because I know I would stress that nervous system, right? So stress to an ADHD brain is like paralyzing. And so I literally, which I do to everybody, honestly, even if you don't have ADHD, I'm more curious than I am upset. So I'm not making threats to people. Like I'm just trying to create opportunity for people to be able to reach the treatment that they want. So when I'm calling and saying, what's going on? Like this, what's keeping you from coming into treatment? I am genuinely curious. Here's her answer. I keep forgetting. And I was like, uh-oh. All right. So let's figure that one out, right? Like if you keep forgetting. So in that beginning phase of treatment, we put together a strategy where I had to help prompt her, right? She put it in her phone and I helped to prompt, right? We created our own little action plan that would get her into treatment, which worked. She started to come into treatment. Interestingly, when I would talk to some of my colleagues, they were like, you are enabling her. What? And they were like, she has to do that on her own. She's an adult. I'm like, well, she's 19 and she doesn't have the capacity. So am I going to say I'm going to do this for the rest of my life? No, we talk about that. Like you need to do these things, but I actually need those neural connections to get wired because it's already been pruned. And so just regular good old neural connections takes about 3 months. So for 3 months, I'm going to invest in her. I'm going to invest in the prompting and then I'm going to pull back a little bit and I'm going to say, all right, let's see. Next week, I'm not going to remind you. Tell me what happens. Let's see if you show up. That's what treatment looks like, right? I'm not shaming her for her own diagnoses, right? That's crazy to me. The limbic system. So again, the ADHD brain feels things hard, so strong, right? Again, in one way or another. They are more easily frustrated and unpredictable. They have difficulty picking up nonverbal clues, which is what was discussed a little bit earlier, from their emotional environment. Or so they don't always necessarily assess things well. That's what puts them at risk for assaults because they don't always assess the danger as well as somebody else, right? Makes regulating behaviors difficult, right? And then that nucleus accumbens, which is the pleasure reward center, there's a deficiency, right? So when we get to the neurotransmitter, it's essentially like a dopamine deficiency. And so these are the limbic system, the same limbic system that we talk a lot about with substance use. So I should have said the emotional CEO. I should have said this is the COO, right? The CEO is your cortex. The COO, this is your limbic system, making all kinds of decisions. So then here's how the neurotransmitters, I think I'm still doing good on time. So the biochemistry of the brain. So this is incredibly important. So hopefully as I'm saying this, I'm saying it in a way that not only makes sense to you, but in a way that you feel like I could say this to my client because they need to understand this too. This is so important for them to understand, even if they don't understand all of the words of the neurotransmitters. I don't care to the extent you can assess that with your patients, but they have to understand themselves because that's the only way you can manage it. How do you manage something that you don't know? How do you understand how to treat it if you don't even understand it? If you just think, I'm just being a punk, I'm just being an ass, I'm just being, right? How do you manage that? So when we look at like what's the chemicals supposed to do for your brain, right? The brain uses these multiple chemicals, so these neurotransmitters, right? Chemical messengers, however you want to say it, to operate your brain, to regulate your brain, and to communicate within your brain. to pay proper attention, the brain has to be adequately controlled, repressed, or slowed down. That's what these chemical messengers do, right? So these four chemical messengers, which are so critical to brain, keep in mind addiction, dopamine. Dopamine helps to repress your impulses. It helps to repress your compulsivity. It is the reward center of your brain. So it's the part of the brain that says, hey, that worked, do that one again, right? Dopamine feels good to the brain, which is the rewarding piece. So when you do something that you have accomplished, good, bad, or indifferent, it's where it is rewarded, right? We all want dopamine to be released in our brains. So for some that don't have ADHD, right, I can get a good old-fashioned dopamine rush from a good conversation with a friend of mine. I can get a good dopamine rush from like a cupcake. For somebody with ADHD, they don't. So they'll get dopamine. They just need a lot more to get it. They need more risk. They need more impulsivity. They need higher stakes. So my daughter, she could get a little bit of dopamine from swimming with sharks. The older one is like, I want to be in the ocean with a great white, no cage. That's what she thinks she needs for the dopamine, right? So that's what we have to pay attention to. This is also what risks for addiction. Serotonin regulates your emotions. This is the feel-good hormone. Everybody loves serotonin, right? It feels good, it's calming, it helps you with your sleep, it helps you with your energy, it helps you with your moods, right? So when we think of an antidepressant, it's an SSRI, right? It's quite literally addressing the serotonin, right? So when we get to ADHD, this is one that it reduces the serotonin, right? And when you are stressed, serotonin is depleted. When you have high levels of adrenaline, which is ironically next, and high levels of cortisol, which is associated with that stress hormone, right? Where somebody that's ADHD, that's chronically stressed, those high levels of those two reduce serotonin. When we look at adrenaline, that plays a key role in the body's fight or flight. So it is an adaptive part of our brain that when you see something that you are supposed to prepare for, adrenaline floods your brain. It's fantastic. It alerts you, it gets you ready, right? All of those wonderful things. But if it's not being utilized, or if it is being utilized to accomplish tasks, which we will get to, that adrenaline becomes the reward. So that's where procrastination comes in. I don't do anything. And then right before, and so this is when I worked with children and adolescents in the school systems, I would say, are your grades like this, up and down and up and down and up and down? And they were like, yes. And I'm like, well, then let's have a little bit more of a conversation about ADHD. Because what we're basically looking at, like the good news is that up, that's where you can be. That's your brilliance. The deep valley is your bored brain. What happens, and this is what I'm sharing with the families too, because they are perpetuating it incidentally, is that your child does well, then they get bored, they're like, boop, doo, right? I'm going to do some other things. I saw a squirrel, I'm going to do all these other things, and then they tank. They're not doing the work anymore. They're not as organized. They're not structured. They're not doing some of the things that they need to do. They haven't figured out a way to study. And then when their grades are bad, people notice and they're like, you have to study. You have to get all these things done. That is so stimulating to the brain. Boom. And so then they're like, oh, I love it, right? The adrenaline comes flooding into their brain, boop, and all of a sudden they get those tasks done. That's rewarding. So then they learn when I am under fire, when I wait till the last minute, when my grades are tanked, I all of a sudden, they don't understand why. Then I kill it. I do really, really well. And I'm like, well, that's the adrenaline and cortisol. Well, we don't want to live off of that, right? We want to figure out a different way to handle that. But that's what you're seeing. So for somebody that doesn't have ADHD, their grades might be like here. You might be a B, C student, a little bit of ebbing and flowing, but ADHD typically it's like whoop, 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 whoop. That's what this is. And so families yelling and screaming and schools like focusing in on it, they inadvertently stimulate the brain with adrenaline and cortisol. And then we perpetuate that that's the way that the child's going to learn best. And then the GABA, its main function is to calm that brain. So when you have ADHD, there's lower levels. So we could almost argue it's a dopamine deficiency. So the lower levels appear to be linked to the impulsivity and the reward seeking. This is where substances would come in. So the conversations I had with my daughter very early is that your brain would react to a substance like it was fireworks. Everybody else is like, oh yeah, it was good. Yours is going to be like, that was the greatest thing I've ever had. So you got to be careful, right? Serotonin, there is lower levels which affect their mood, affect their sleep, affect their aggression, affect their ability to shift attention. Norepinephrine, which we didn't talk about in the last one, is that one that helps you to sustain tasks, right? So you get that and it gives you an attention. It's an alerted chemical in the brain that they don't have as much of. Adrenaline, which we just talked about, and then that GABA, those lower levels lead to the difficulties with the behavioral inhibitions, right? So you're not as calm. And so you engage in these more increased impulsivity and impaired attention seeking behaviors. This is a lot of brain stuff, so I hope that you're all hanging in with me. I'm going to move through a little bit, but I do think that it's important enough that we understand the brain because it's the only way for me that I feel like we're going to get rid of the stigma. We're going to stop saying that this is just people being lazy or bad because this is quite literally chemistry of their brain. And there's things that we're currently doing that exacerbate it. So yelling at a child who's doing poorly in school increases the likelihood of them fueling their activities through the adrenaline and cortisol. That is counterintuitive. A child that doesn't get enough dopamine is going to find a place to get dopamine. So if we don't figure out a way for them to successfully have that experience, then they're going to find one. And oftentimes it's a substance. And so they introduce themselves to alcohol and marijuana, and that's their only one. It's the greatest thing in the world to that brain. Shifts. It's not the same as somebody else's brain. Just like I can eat a Twinkie and not have my spike in insulin require me to have a shot. And somebody that has diabetes has to have that differently, right? Same thing, our brains respond differently. So again, I've already kind of talked about that. So when we look at the ADHD and the dopamine, this is a picture that again becomes important enough because what this is showing is not that there's something wrong with the brain. This is showing the level of dopamine inside the brain. So if you talk about this in the way of like, all right, so I have to fill these two bowls, right, with dopamine, a liquid. We're gonna say that it's a liquid, right? We're gonna fill these two brain bowls full of a liquid called dopamine. If you look at the brain, I don't like that they have that it says normal, right? I don't like that. But if you have the brain that does not have ADHD, you don't need a lot of liquid to fill that, right? You're probably like, maybe a half a glass of dopamine is probably going to be okay. If you have to fill the brain with ADHD with dopamine, you need a lot. So they up the ante. That's the higher risk. They're gonna feel what we feel when we get dopamine, but they need more of it. So that's the upping the ante for what the risks taking is, what they need to do to feel stimulated, what they need to feel happy, right? So it's the same thing. There's nothing wrong with the brain. There's nothing broken. It's just they need more of it. So then this becomes the perfect storm. For those of you that know me, I do love this analogy. I use it all the time, right? What's the perfect storm that actually creates the behavior that we're trying to address? So the perfect storm is that you got a brain that's underdeveloped because they're still young adults. You have ADHD, which means that it's complicated. All the parts of the brain that are trying to develop, ADHD delays it. And then you add a substance, right? So an under-aroused brain is looking for stimulation. The uninhibited brain is looking for ways to be able to get stimulated, and they don't have the part of their brain that says that's probably not the best idea. You probably shouldn't do that one, right? You shouldn't swim in a ocean with a shark, a great white, without anything, right? That's the lower GABA. You have a frontal lobe that takes longer to mature, closer to 28. So you have a 24-year-old in treatment, their brain's not even done developing. And if they have ADHD, it's definitely not even until at least 28. Could be even longer, right? The limbic system is now running the show. So you've got an erratic, emotional, impulsive part of the brain that is making the majority of the decisions because that cortex is not even online yet, right? Or limitedly online. And then you have genetics, both within substance use and ADHD. So then here's the vulnerability for substance use. And so I'm going to go through some of these a little bit quicker so that I have at least 10 minutes to get to it because I've been highlighting a lot of the brain. So the limbic system and the dopamine. These are the risks associated with addiction. Cocaine being one of the ones for ADHD that we see the most. And so again, I would oftentimes ask, it's not my only question within the assessment, but I would oftentimes ask, what substance did you start with? For those with ADHD, a lot of them started with cocaine, marijuana, and alcohol, right? Those are the big ones. So the effects of substance on the developing brain, right? So again, for all the things that I just talked about, those core pieces of the brain that aren't developed, substance use, think about the pruning system, right? Lose it or use it. When you add a substance to a developing brain, it becomes a part of the pruning system, and that use it or lose it, that gets used, and then the other coping skills get lost. They get pruned away. So that increases the risk and why it sometimes can delay a young adult's ability to be able to build some of these coping skills. Younger brains are more susceptible to alcohol. So this is another one, again, especially if you're working with those in children and adolescents. It takes 8 to 10 years for an adult to travel from experimentation of alcohol and drugs. So an adult, it takes 8 to 10 years, not with heroin, right? That's a different beast, but it can take 8 to 10 years for somebody to become fully dependent on a substance, 3 to 15 months for an adolescent. That's a conversation that needs to be had, right? It doesn't take very long for an adolescent brain to become dependent on something that an adult, that's why they always say, wait until you're like 24. Your risk of somebody being an adult developing a substance use disorder is significantly less. 3 to 15 months for somebody to get addicted in that developing brain. Scary, right? So we've already talked about that. So ADHD and the substance use. Again, I'm going to go through these a little quickly because of time. So difference in that brain activity. So again, the pleasure pathways, the dopamine deficiencies, all of the things that I have just talked about, the nucleus accumbens. So you're hearing the same words. Nucleus accumbens, prefrontal cortex, limbic system. Those things are the parts of the brain that are not developed, are most impacted by ADHD, and are the vulnerabilities to addiction. Those same three parts. Holding hands, right? The worst stool you could ever sit on. So here's the risk. Again, here's an interesting piece that when they've started doing some studies, which they are, right? ADHD is becoming more and more. They found that of the young adults, only 30% said that they used substances to get high. That's a conversation because most of them are trying to feel better. Most of them are using it to sleep. Most of them are doing it so that I can go to school. Most of them are doing it because I want to be more social. Those are coping skills. That's what's going to increase their risk. They're not using it to get high, but your brain is your brain. And so you use something enough and you turn on that light for addiction, all bets are off. So here's just some statistics. Again, you'll have access to this and certainly it feels like I probably need to do another one of these because there's a ton of questions that I wasn't even able to get to. But we're looking at a high likelihood of those comorbidities, right? Here's some testimonies. This one I'll send out, right? So just somebody, I think it's important. So again, in college, my mind was so out of control and drinking would make that go away. I didn't drink to get smashed, but to concentrate on my homework. Are we asking the right questions? The boredom was impossible. So I had a young adult, right, that had rip-roaring ADHD. And so what I had to actually have him do was we figured out like he liked driving race cars. He had a lot of suspended licenses, right? Not at the time. And so we talked about his ability. Now, this was somebody that had the means. So some of the kids that didn't have those means, we looked at other alternatives. But just as an example, he started to go to like Dover Downs, rent like a high speed car that he could just do because he needed some place that he could grab a little bit of adrenaline that didn't result in him using those substances. So that's the creativeness that you have to think outside that box, right? Sometimes they're using because of the boredom. And then when they use weed or cocaine, their brain's not bored. So it's reinforcing. And then they stumble into addiction that they weren't even looking for. Those are some of the change. So when we talk about marijuana, which I did talk a lot about, so this is the most widely used illegal substance among adolescents. It is on the rise. This is a conversation that people are still shying away from, and everybody should have it. The research we have today that says the complacency and the acceptance of marijuana is on adult brains. I just showed you how long it takes for an adult brain to become addicted and for an adolescent brain. So when we have adolescents that are using weed chronically, They run the risk of addiction. And once addiction sits inside that brain, that light switches on and addiction doesn't care what they use. That's when somebody uses something more, right? So those are conversations that we need to start having that are still struggling with. But that is the most widely used. Same parts of the brain. So again, why does marijuana hinder? Because it affects them executive functioning. Because it quite literally, so where we can't argue, right? So when teenagers are like, I love it, and I'm like, I hear you, right? What we're not going to be able to argue is like, we know that marijuana slows down the executive functioning. We know that marijuana slows down your ability to stay motivated. This is where we see high rates of college dropouts, right? Because they're not motivated and they don't understand it, right? So I had ADHD when I was in high school, and then I get to college and nobody's overseeing me and I'm smoking weed. I just don't really getting up and going to class, right? So that like that already kind of lagging executive functioning when you smoke weed is like now carrying 100-pound weight trying to go up a steep mountain. So I'm just giving the information to them because I'm assuming that you wanted to be successful in school. And so I'm going to give you some information about how to get there. And you can not do it, but you need to be informed about it at the very least. Impacts your marijuana, right? Goes after the dopamine receptor site. Today's marijuana is not the same as it was in the 60s, right? So we're talking about very different marijuana where the psychoactive ingredients are a lot stronger. That THC is a lot stronger than it was, right? 30 years ago. And so it becomes a part of their coping skill. And that's where we start seeing some of the changes. So it just complicates it. Here's the comorbidities, the vulnerabilities that I continue to reinforce, right? So the lower self-esteem, the humiliation where they feel like they should have been smarter, they should have done it better. I don't know why I did that. I'm so stupid, right? All of those things become a part of that inner voice. Feeling defeated. So when you think of a child that was working as hard or an adult or a young adult that's trying as hard, we had a young adult that was trying to leave treatment, right? And when I sat with them, right? So they were ready to discharge him. And when I sat with him, I was like, what's going on? Because he's showing up to this one group. Like, what's happening here? When we asked the right question, what he said is that it's hard for me to sit for a 2-hour group and it's embarrassing because he has these inner stories anyway. He doesn't want to look stupid. He doesn't want to be pacing in a group room where other people could tease him. Like, dude, sit down. What are you doing? Right? Or a therapist to yell at him. That was it. This isn't a kid that didn't want treatment. This was a kid that couldn't sit for 2 hours. We can fix that. That's the shift, right? But we have to understand it before we're able to do that. So when I said the assessments are critical, these are the assessments. So I'll make sure that this is one of the ones that Callie sends out. These are the different assessments. They're a little longer. So I haven't found one that's convenient for an inpatient where we have to do these frequently, but these are full assessments. And for anybody with ADHD, they should get a full assessment. All right, so here's the treatments that I'm going to go, and then I will take a couple minutes to answer some of those questions. I apologize, I'm rushing a little bit, but I want to make sure I get to this, right? So I spent a lot more time on that brain piece because I think it's so critical. So again, the goals of therapy with somebody with ADHD, they need to understand that they have ADHD, period. They need to have self-awareness of those coping mechanisms. They need to understand how to manage their impulsivity and their hyperactivity in order to be able to manage their substance use. Like that is what is going to have to happen. I need you to understand this piece in order for you to be able to do this piece. They need to figure out how to have those healthy and balanced relationships because again, oftentimes ADHD is riddled with conflict. And so it's an avoidant, right? So those with ADHD are oftentimes the ones like, don't call my family, don't involve them. I don't want to be here. I don't want, because they're avoidant, because they're worried about the stress. That makes sense. And we need to educate your family about it because otherwise they're not going to know how to manage this with you. As I had said before, these are the implications. If we don't focus in on this, then recovery becomes harder. If they don't know how to get themselves from spot A to spot B, Monday, Wednesday, Friday, then this is going to get in their way. And then eventually they will end up using again. If they don't know how to be organized to say, dude, you can't get to your probation officer and treatment in an hour. We're 45 minutes from your probation officer, and that's saying that you got there on time. Like that's some of the stuff that they need help with regulating. If they don't have regulation skills, that will get in their way because when they get frustrated, when they don't have things go their way, they have those strong emotions, which tip them into making other decisions, right? Planning, time management, flexibility, those are things that they struggle with that will interfere with their ability to recover. So here are the treatment approaches. CBT, very effective. DBT, very effective. Family coaching, very, very important, right? Understanding how sleep impacts it, understanding how diet and nutrition. There's a lot of research to say like omega-3s are super great for the brain. So putting that into your diet, making sure that you're eating certain foods that have higher dopamine, making sure you're not doing high sugars, right? Not because ADHD is triggered by sugar, but because it's just not good for your diet. Exercise, there is a lot of research that says that exercise shows the equivalency of a stimulant, right? For some people, that level of exercise that they're getting so much neural activity that they haven't needed to. That doesn't mean everybody, right? This is a spectrum disorder. But exercise is so critical to the sustainment of ADHD, right? Intense treatment in the beginning. So I used to always say this is like going to a dentist office. I'm going to do like your whole cleaning and then I'll see you once a year, right? So we're going to do a lot of work and then we're going to do a lot less. So that's typically what happens because I got to go after these certain things pretty quickly. And then I'll see you in like 3 months, right? 6 months. Pharmacological. So I'm going to end with this. So pharmacological interventions. A lot of families are terrified that their loved one is going to take prescriptions, including stimulants, and that they're going to abuse them. So here's what research keeps showing that when somebody is treated appropriately for ADHD with behavioral and medical interventions, they reduce the risk of substance use. So you can take a stimulant and not run the risk of abusing that. It actually reduces your risk. But when I worked with a lot of adolescents and young adults, they were taking their stimulant and smoking weed. And I was like, one of these two has to stop, right? Because we don't need both of them because they're counterindicating him, right? So we had conversations. So when they would up their stimulant, because they were like, my stimulant's not working. I'm like, it's not that it's not working, it's that you're smoking weed, right? So you're countering it. So we have to have these conversations because if we keep upping it, you're going to start running risks because you're already taking an addictive substance. You turn that light switch on, it doesn't matter, right? But when research continues to look at a person that is not treated for ADHD runs a higher risk of substance use than a person that is appropriately. So pharmacological was associated with an 85% reduction in risk for substance use and ADHD. But that means somebody needs to be asking the questions. Are you using something else? Are you smoking daily? Are you drinking actively? Right? Are you taking your meds as prescribed? Because when they are combined, we reduce risk. And so when they've done research that is newer, this is the most recent research, right, that we don't typically see as much, and there's a lot more needed, that adults with ADHD who use their extended release medication, so those XRs, right, so Concertas, so there's some medication that is a slow release, right, it releases over the course of like up to 12 hours. That shows the lowest risk. The quick releases they haven't seen as effective. And so the quick releases is like just Ritalin. It's just Adderall, not the Adderall XR, right? That's slow release, but the quicker ones that they run a little bit of a different risk. So patients used in the instant didn't take their medications as regularly because it was quick. And they had more likely seen occurrences that ended up in the ER or in a mental health or in a home health system, right? So some level of a behavioral health, but the slow releases showed a lot more promising, right? So we shouldn't be talking people out of taking their medications, but if addiction is already there, then we need to have appropriate conversations about both. And so there are a lot of questions. We are at time, so I will um, potentially do like a part two because there's a lot of questions that I didn't get to. But I can try and answer some through those emails.
Yeah, I was thinking either we do a part two or there were a few overarching questions like in relation to bipolar and that kind of thing. So maybe we just take a few of those overarching questions and we include that in our follow-up email next week. And you could just speak to
Okay.
a few more of those.
Yeah, yeah, yeah. So bipolar and ADHD, not the same thing. So I'll just say that as a really quick one.
Yeah.
But mania can look like ADHD. So again, a good assessment is going to be critical to the success of our interventions. So a
Hmm.
good assessment is always going to be the appropriate intervention. Bipolar can look like ADHD, but it is not. And we should not be giving somebody with bipolar that stimulant because it'll increase the behaviors. Same as trauma.
Yeah.
So
Well,
thank you, everybody. I appreciate all your time.
we
Have
knew
a
this would be a
wonderful
good one. And just a reminder, I will send out the email within the next 2 hours. So don't email me within the next 5 minutes if you haven't gotten it because I haven't sent it. And you'll get the email next week with the recording and those resources that she mentioned, the videos, key slides, and we'll see you all next month in February. Thank you all. Thanks, Trish.
Thanks, everybody.